We also have a provincial partner in terms of the local hospital integration network personnel. And that is what we deal with from a health perspective. And at this time, it's my pleasure to introduce Cal Martel, representing the LHIN. Welcome.
My name is Cal Martel, and I'm the acting CEO for the Champlain Local Health Integration Network. Very pleased that the councillors have allowed us some time on the agenda to speak with you today around a very significant but too often tragic circumstance of youth addictions and overdose faced by both the youth and their families in our region. Over the course of discussions over the past couple of weeks, you would have heard, I think people were reiterating the analogy of it takes a village to raise a child. And nowhere is that circumstance more true than the type of situations we're dealing with today in terms of youth addictions and overdose in that respect. So I think with the range of partners you have here this evening, from schools to public health to community policing and paramedics, parents, families, and the public at large all have a role, as people were saying, in addressing this challenge. The Local Health Integration Network, or LHIN, is eager to play a role in that respect as well. And so my purpose of being here this evening is both to give you a bit of an understanding of the range of services and treatment options that we currently fund in our healthcare services, but more importantly, to listen and really understand what other types of solutions we should be considering on a go-forward basis in that respect. So the Champlain LHIN plans, funds, and manages all healthcare resources in the region for the most part, ranging from hospitals to home services, but including mental health and addictions. We have a total of 210 residential treatment and stabilization spaces or beds that we currently fund across the region, of which 29 are specific to the needs of youth and their families going forward. We've also been very pleased to have the opportunity to recently approve a capital project going forward for the Dave Smith Center, which will both redevelop and expand the capacity. So we'll bring on some additional services and resources over the next couple of years. But for people who are, including youth, who are ready to seek treatment options for their addictions, we do have a single point of referral within Champlain region, so all of Eastern Ontario, the Ottawa Addictions Assessment and Referral Services that can guide them through the referral process and really help match them to the treatment option that is most appropriate for their needs and their preferences. And the other advantage of going through the ORS program, as we sometimes call it, is that in circumstances where they may have to wait a couple of weeks to get access to the service they need, they will have access to counseling and support. And if their needs change, their needs can be prioritized, so they can access those critical resources on an urgent basis, same day, in terms of very critical resources going forward. And I think probably downstairs staff in the program were available and have further information on that program. Also, we're one of the funders for supporting Project STEP, which provides individual substance abuse counseling and support in all publicly funded high schools in the region. This unique partnership among the 4 hospital or Ottawa school boards, Maison Fraternité, Readerwood Addiction and Family Services, Ottawa Public Health, and United Way, amongst others. Counselors spend an average of 14 hours a week in each school providing individualized counseling and support with respect to addictions in that respect. So it just gives you a sense of the range of services that are available. And I think earlier Israel talked about sometimes the challenges aren't always about are enough resources out there, do people know what's available. So really wanted to give you a sense of some of the services we currently fund, but then through the Q&A and afterwards have a better understanding from your perspective on some of the other solutions we need to be looking at going forward for this population. So thank you.
The Royal Ottawa, and I get back, there's nothing available. Not only is there nothing available, but they're cutting addictions counselor slots, and now they're cutting the beds for these kids. So my question is, are we dealing with that and these 29 beds that are specifically set aside for kids, is that the new number after this cut? Or are we cutting these beds down to 15? 15 beds for the kids in our community, just in the Royal Ottawa. How is that a progress?
Really appreciate the question and certainly understand the frustration. There's certainly, in a lot of health service providers over recent years, there's been a need to realign in how they use the resources. The circumstance of the Royal, however, is one, in fact, where they have increased the clinical expertise of staff that are working with children with both mental health and substance abuse problems in that respect. So there have been some staff changes, but it's really to add additional clinical expertise in that respect. In terms of the 29 beds we currently fund, they've been in place for a period of time, and in fact, as I mentioned in my comments, we're growing the capacity. The challenge I think we really want to hear more about is, for the resources we have available, how do we ensure this information gets in the hands and minds of the youth who need it?
My follow-on district card nurses and nurses, and no, not to take away from their expertise, these are fantastic people, but the cost that we can get for one psychologist or psychiatrist, we can get multiple numbers of addictions counselors. So I would put to you, sir, and to the other experts here, to tell these people here who are losing their kids to addiction, which is more important, the addictions counselor or the psychologist?
So I think probably both are needed, absolutely, but in terms of the program for transitional age youth at the Royal, which is going from CHIO and various others, the experience over the years has been that the concurrence of both mental health problems and substance abuse has created a level of complexity that really what does require a stronger level of clinical expertise to respond. That we need more capacity in the community and beyond around addictions counselors, no question. That's one of the things we want to talk about with you here this evening.
So what are you doing to address the capacity issue and people waiting 12 months to have their kids go into a treatment facility, please?
No, good. There's no doubt that there are waitlist issues.
210 beds? You haven't increased them at all in 2 years. So tell me how you're going to increase capacity.
We have increased capacity in recent years, but in terms of the waitlist issues, it absolutely is an issue. And we know that people are waiting sometimes weeks to access services that we need. It's one of the reasons we had set up a number of years ago through the Ottawa Addictions Assessment Referral Service, a centralized intake that can really prioritize people so that they are able to get access to the services that they need. But having said that, really understand the frustrations that individual people might experience in trying to find the services.
So I guess drugs is like choices, just like kids. I think kids make choices and we make choices with our healthcare dollars.
Okay, when you have the mic, you're